Hey everyone! On this occasion, I will talk about 5 common signs of high blood pressure that you should know. Knowing the early 5 common signs of high blood pressure can help you receive the best treatment before it becomes serious or even life-threatening. So let's get started with a closer look at what high blood pressure is first. The heart is a muscle that pumps blood around the body constantly, during every second of our lives. Blood that has low oxygen levels is pumped towards the lungs, where oxygen supplies are replenished. The oxygen-rich blood is then pumped by the heart around the body, to supply our muscles and cells of each organ from the top of the head to the bottom of the feet. The pumping of blood creates pressure, blood pressure. If a person has high blood pressure, it means that the walls of the arteries are receiving too much pressure repeatedly, or high tension in the arteries, due to an increase in the pressure of the blood flowing through it. Your blood pressure is high if the reading is higher than 140/90. Normal blood pressure is below 120/80. Blood pressure between 120/80 and 139/89 is pre-hypertension, and blood pressure 140/90 or above is considered hypertension. If left untreated or uncontrolled, high blood pressure can cause many health problems. These conditions include heart failure, vision loss, stroke, and kidney disease and other conditions. And here are 5 common signs of high blood pressure that you should know. 1. You have irregular heartbeat. The first common sign of high blood pressure is irregular heartbeat. Increased blood pressure forces the myocardial muscle of the heart to work harder than they're designed to. Over time, this will wear down the muscle and make it weaker. At this point, the heart will be unable to pump blood with the same power and making it seem irregular. If you notice that your heart isn't beating to a rhythm, it's best to consult a medical professional to get an evaluation right away and get high blood pressure test if needed. 2. You feel fatigue and dizziness. The second common sign of high blood pressure is fatigue and dizziness. It shouldn't come as a surprise to learn that our bodies need oxygen to perform everyday tasks. So when your lungs can't get enough blood to properly oxygenate your system, many functions will become compromised, including your brain. Over time, you will begin to feel tired earlier and much easier than before. 3. You have vision problems. Vision problems like blurred vision is the third common sign of high blood pressure. The retina of the eye transforms light into nerve signals, which are then sent to the brain for interpretation. When the blood pressure gets too high, the blood vessels leading to the retina can narrow, which will restrict blood flow. Over time, this can damage the retina and limit its function, causing a number of vision problems. 4. You experience difficulty breathing. Another common sign of high blood pressure is difficulty breathing. Difficulty breathing, or shortness of breath, is one of the first signs of pulmonary arterial hypertension, PAH, a condition where the pulmonary arteries are constricted and prevent your heart from pumping adequate amounts of blood through your system. The suffering from PAH are unable to effectively swap oxygen-rich air with oxygen-depleted air, making everyday tasks much more difficult and cause due to difficulty breathing. 5. You have severe headache. The last common sign of high blood pressure or hypertension is severe headache. The verdict is still out on whether or not high blood pressure can cause headaches, and high blood pressure can trigger malignant hypertension, an event often referred to as a hypertensive crisis. During this crisis, pressure in the cranium builds up, resulting in a very severe headache that does not respond to traditional treatments. Are you worried that you or someone you know may have high blood pressure or hypertension? Having some of the signs of high blood pressure doesn't mean you definitely have the condition, but you should always contact your doctor, just to make sure. The earlier you can identify you're having hypertension or high blood pressure, the better your chances to get the best treatment. While it may seem like a small issue, it's never a bad idea to get checked out if there's cause for concern. Ruling out a high blood pressure or getting early treatment could save your life. There's no better treatment for raised blood pressure than prevention. The sooner you can find out what your blood pressure is and can take steps to reduce it, the better. Knowing your numbers could save your life. Making sure you don't have high blood pressure is just one of the many reasons to receive regular checkups from your doctor. Thank you for watching 5 common signs of high blood pressure. Early detection could save your life longer. Subscribe for more videos. Hope you feel better.